Hello everyone. So today I'm going to talk about counseling for smoking cessation. So how to do the data gathering here. So in the P1 we are going to ask the journal questions about smoking. So we'll start with what do you smoke and how many cigarettes a day are you smoking? Since when have you been smoking? Okay, and are you gradually increasing it or has it been the same amount since you started? Okay, and when do you need your first cigarette of the day? This question is also very, very important to let you know whether the person is using, cigarette smoking as an eye opener. All right. And if you were to quit smoking, which cigarette would be the most difficult for you to quit? Okay. So would it be the morning cigarette or the afternoon cigarette or the evening cigarette, or which one would be the most difficult for you to give up? Okay. Then we'll ask about the previous attempt, like alcohol dependence and substance abuse. We will ask about the previous attempts here as well. Okay. So have you tried quitting smoking ever? And when was that? And how did you try it? Was there any professional help, or did you do it on individual basis? Okay, is there any particular reason that is pushing you to smoke towards smoking? Okay, it could be low mood, it could be financial struggle, it could be stressful job or anything else. So you should ask about that because in the management we need to work on the cause that is basically pushing the person towards cigarette smoking. And we'll also ask that, in your opinion, what was the reason that led to the failure of your um, quitting of smoking, okay, previously. Then we'll ask about the rest of the history, that is any medical conditions, any allergies, any regular medications, and the psychosocial as well. If the patient has any medical condition, for example, ischemic heart disease or COPD, okay, any condition that is linked medically to smoking, we will tell the patient, we'll ask a few questions about the medical condition, that when did it start and is it progressing? And do you know that it is linked to smoking? And then we'll explain the entire link to smoking, that smoking is causing it to become worse and worse. And that's why you need to quit smoking. Okay, so we will have to explain the entire rationale behind the link of the smoking to the medical condition and why the person needs to quit. Okay, then we'll ask about ideas, concerns, and expectations, any fears regarding the quitting process. In examination, you will only do vitals. In management part, we'll tell the patient that there is a lot of help that is available in the NHS regarding smoking cessation. Would you like to know about some of the options? And then we will tell them about the options. So we'll tell them that if you consider quitting smoking, then we can refer you to the smoking cessation clinic. Okay. The people at the smoking cessation clinic, what they will do, they will help the person to decide a quitting date. Okay. And 2 weeks before the quitting date, they will start the patient on the nicotine replacement therapy. Okay. So what nicotine replacement therapy do? It decreases. It also contains nicotine as in cigarette, but it does not contain other harmful chemicals like tar and many of the other chemicals that are there in the cigarette smoke. So with nicotine replacement therapy, the person will they will have reduced craving for smoking, and it can be in the form of pills, it can be in the form of patches, and it can be in the form of sprays. So this is nicotine replacement therapy. And other than nicotine replacement therapy, another option, the alternative is medication, and the only medications that is considered helpful in smoking cessation is bupropion. So for bupropion, the protocol is the same. We will refer the patient to smoking cessation clinic. They will help them decide a quitting date, and they will start them on bupropion 2 weeks before the quitting date. Okay, and so bupropion will be taken once a day, and the entire procedure will take about 2 months. Okay, and then after discussing all of these smoking cessation options, we'll tell the patient that after learning about all of this, would you like to consider quitting smoking? And if the person says yes, then we'll arrange a referral. We'll tell them that we are going to arrange a referral for you with the smoking cessation clinic. But if they say no, then you will then you will need to be empathetic, and then you will need to consider that the person has been smoking for a long period of time, and it's not a decision that they can make in one consultation. So I'll tell them that I understand it must be very difficult for you to make the decision right now. So how about you go home and you think about it and you discuss it with your family and friends, and I will give you some leaflets as well, and you can let us know whenever you are ready. Okay, so that was all about smoking cessation, and I will see you soon with another video.